Understanding how Medicare and Medicaid work in New Jersey can be difficult. They sound similar and seem to have many overlapping benefits. The truth is these two programs are very different, and mixing them up can lead you to not getting the health care you deserve. In this video, we'll discuss the differences between these two programs and specifically how Medicaid eligibility changes once you become Medicare eligible here in New Jersey. I'm your Medicare guy, Ken, and this is Medicare Explained, presented by NJ Life and Health. Before we go forward, I have to give you a quick note. This video will better help you understand the Medicare and Medicaid systems, but we do not help people apply for Medicaid. We help people with Medicare, not Medicaid. It is a state program and must be done with the state or an agency specializing in Medicaid applications. Let's first talk about the differences of Medicare and Medicaid. Medicare is a federal program that provides hospital and medical coverage to people over 65 and people under 65 with disability status. Original Medicare does not consider income for eligibility. It only focuses on age and disability status. Original Medicare boasts a nationwide network of doctors and hospitals, but lacks benefits people often seek, such as dental and vision care. It also does not cover nursing homes, which is important for later. Many people like Original Medicare, but find it lacks the comprehensive coverage they desire. To help address these coverage gaps, they often enroll in secondary policies such as Medicare supplements, Medicare Part D plans, and Medicare Advantage plans. The secondary plans available to you and their cost can vary greatly depending on your location. Now, understanding the differences between these different Medicare secondary plans is our specialty here at NJ Life and Health, and if you'd like help choosing the best one for your health needs, contact us today. You can reach us at 848-226-6897 or visit our website, www.njlifeandhealth.com. Now let's talk about Medicaid. Medicaid is a federal and state program designed to help people on the lower end of the income spectrum obtain health insurance. Medicaid programs are managed by the states but receive federal funding. So the benefits you receive on Medicaid and the eligibility requirements vary heavily from state to state. To qualify for Medicaid, you must generally have a low income and low resource count for things such as cash, stocks, and investments. But again, this varies. Medicaid programs tend to have smaller networks. This is because they have lower payments from the program to many doctors, and many doctors have opted not to take Medicaid patients. However, you will most likely have zero out-of-pocket costs if you are on Medicaid. Most programs have $0 monthly premiums and no required payments at Medicaid providers. Medicaid also tends to have more comprehensive benefits compared to Original Medicare. It often includes not only hospital and medical coverage, but prescriptions, dental, vision, transportation, and more. Most importantly, it can cover nursing homes. In New Jersey, Medicaid is referred to as NJ Family Care. If you'd like their website, we'll link it down below. So let's talk about NJ Family Care Aged, Blind, and Disabled. So now that you know the differences between Medicare and Medicaid, let's talk about how they interact here in New Jersey. If you are on Medicaid, otherwise known as NJ Family Care in New Jersey, and become Medicare eligible, you will most likely be moved to a program called NJ Family Care Aged, Blind, and Disabled, or ABD for short. NJ Family Care ABD is designed for people who are dual eligible, meaning they qualify for both Medicaid and Medicare. Once you are eligible for Medicare in New Jersey, it is very hard to maintain your Medicaid status if we're being honest. As of 2024, the maximum income for an individual enrolled in NJ Family Care ABD is $1,255 a month, or $1,704 per month for a couple. The resource maximums are $4,000 for an individual and $6,000 for a couple. Unfortunately, due to this, we are finding that many of our clients who have been happily enrolled in Medicaid for years no longer qualify for it. If you are on NJ Family Care and become eligible for NJ Family Care ABD, there is one big change. You are now going to be dealing with your county social services office. All NJ Family Care ABD cases are through the county social services offices, meaning all applications and correspondence are now through there instead of your state NJ Family Care agency. Let's talk about how COVID affected Medicaid eligibility. During COVID, the federal government stopped Medicaid disenrollment across the country. This meant if you were in Medicaid, you couldn't get kicked off, even if you were no longer eligible due to a change in income or Medicare status. We found many of our clients who were turning 65 or going on to disability during this time were able to keep Medicaid, even though they weren't eligible due to their income and resources. Over the last year, the federal government has implemented the Medicaid Unwinding. This is the process of slowly making people who were in Medicaid reapply. A large percentage of our clients have found they are no longer Medicaid eligible and have had to transition to Medicare. If you are disenrolled from Medicaid, you are given a Medicare special enrollment period where you can choose to enroll in a Medicare Part D plan or a Medicare Advantage plan. Medicare supplements often require underwriting if it is outside of your initial enrollment period or open enrollment period. So to dive into this further, a lot of people were turning 65 and they were maintaining Medicaid. And we said, there's no way that should be the case. We're looking at your income, you're looking at your resources, and they were able to keep it. Unfortunately, over the past couple of years, they have been slowly kicked off and they are now just on Medicare. Let's talk about Medicaid dual eligible plans. If you can keep Medicaid once you are Medicare eligible, you are in luck. Being dual eligible means you can enroll in some fantastic Medicare plans. These dual eligible plans not only have the potential to have $0 out-of-pocket medical costs, but may include benefits like helping pay for groceries and utilities. If you are dual eligible, contact NJ Life and Health to look into your options. As you're watching this video, you may be thinking, why is it so hard to keep Medicaid in New Jersey? We talk to a lot of people who are on the low end of the income spectrum who wonder why it is so hard to keep Medicaid in New Jersey. The primary reason for this is Medicaid can help pay for nursing homes. Nursing homes are incredibly expensive, and the state does everything it can to ensure that you absolutely qualify for this benefit. The process of applying for Medicaid for a nursing home is time-consuming and incredibly complex. If you'd like more information on this process, you can watch our podcast with Senior Planning Services in the link below. Senior Planning Services is a company that focuses on helping people apply for Medicaid in New Jersey. They go in depth on what to expect, and if you want to reach out to them, I will also link their website down below. Just so you know, it is a time-consuming and sometimes very emotional process, so just be ready before going in. Let's bring it all together. Keeping Medicaid once you become eligible for Medicare in New Jersey can be difficult. We find that more often than not, people have to transition to just Medicare. We recommend talking to NJ Life and Health a few months before becoming Medicare eligible to review your options. We can help you get a fantastic dual eligible plan if you maintain Medicaid, or if you lose Medicaid, we can help find a great Medicare secondary plan for your needs. To contact us, call our Toms River, New Jersey office at 848-226-6897 or visit our website at www.njlifeandhealth.com. If you have any questions about anything at all, leave us a comment down below and we'll get to you as soon as we possibly can. And if you have any more questions and you like to just learn things on your own time, we have hundreds of videos on the NJ Life and Health YouTube channel that can help you in your Medicare and life insurance journey. So once again, I'm your Medicare guy, Ken, and this has been Medicare Explained. I'll see you in the next video.